So today I will be talking basically about food insecurity based on my 10 years experience on this topic and how it's led to research implications that are culturally driven. Two of my main focuses today will be on the importance of reframing food insecurity as a women's health issue and thinking about it as something that's cumulative over time, starting from childhood. I also will talk about the importance of including men. So while I think it's a women's health issue, we still need to include men in the research, and I'll explain why when I get to it. And then I'll end with the importance of doing a community-engaged research. I was trained as a population health scientist, and it wasn't until I added this component of community research into my research agenda that I felt that I fully started to understand the topic and started to make putting more of the puzzle pieces together. So food insecurity as a women's health issue. Let's just review some of the topics. So women are more likely than men to be categorized as food insecure, partly because they are usually the caregivers, they're single mothers. So we have higher rates of food insecurity among women compared to men. We also have higher rates of food insecurity among Black and Hispanics compared to white individuals. But what's interesting is that when we look at our prevalence rates of SNAP participants, we see higher rates of SNAP participants among white individuals. Most of my work has used either a cumulative risk model and an ecological framework. And the reason being is that obesity and food insecurity, my two main areas, are multifaceted topics. And when you're looking at multifaceted topics, you need something that can encompass a bunch of risk behaviors. So the cumulative risk model discusses that it is the repeated or continued exposure of an adverse event that leads to a negative outcome such as food insecurity. So in other words, it's the accumulation of risk factors that lead to a negative outcome. It's just not, one bad experience. So that one bad experience that you had, that you failed your exam, is not what's going to lead to food insecurity. It is years and years and years of repeated experiences of living in poverty that can lead to this negative health outcome. And then eventually this pile up of stressors can then spill over to other health domains such as obesity and diabetes. The other framework that I use a lot is the ecological framework because you can look at food insecurity in multiple systems. So food insecurity is influenced, it's not just at the individual level, but it's also at the family level, it's also at the community level, and it's also at the public policy level. So if we look at it in terms of at the family level, here's an example of how there's multiple indicators at the family level that can influence food insecurity. So we've got parenting stress, we've got unemployment, parental incarceration, mental health. So we had all these competing stressors going on in one family. We can see how those accumulation of stressors can influence, constrain money, also reduce time for cooking and reduce time for preparing food and shopping for that food, which can then lead to reduced resources for food. One of the studies that I did focused on the family and doing this, sorry about that. The family environment and 4 different domains, specifically financial stress, maternal health, family disruption, and parenting disruption. And with each of these domains, there were multiple indicators or multiple stressors that could be going on. If you add up these multiple indices, such as economic stress, maternal unemployment, disabilities that could limit employment, and multiple sources of employment, the more stressors under one domain, the more at risk you are for a particular negative outcome. For today, I really want to focus on the results of maternal poor health. We found that maternal poor health was a positive indicator of differentiating between the various levels of food insecurity. Specifically, mothers that were in poor health were more likely to have households with very low food insecurity. This should not be so surprising because we know that there's research indicating that stress associated with food insecurity diminishes women's physical and mental health. Some of my research that have looked at intimate partner violence and depression has seen this association with food insecurity. The problem with this is that when we think about food assistance programs, they're just that. They're food assistance programs, when in fact, food insecurity is a much larger issue and just not food. There's multiple indicators, multiple reasons why people are food insecure. Women have a tendency, especially mothers, if they're food insecure, the first thing they're going to do is address the issue, which is get food on the table for their child. But the secondary, what they think is secondary, what I would like to push forward as primary, such as intimate partner violence or mental health issues, are not addressed. And that's partly because our social service systems are just disjointed and we have a tendency not to talk to one another, followed by our food assistance programs just focus on food assistance programs, and we're not thinking about the collective whole. Related, context matters. So we have a tendency to think about food insecurity as here and now. So when we look at adult food insecurity, we think about it as they're experiencing this for the first time right now. If you take a step back and do include in your surveys childhood experiences of food insecurity or childhood experiences of financial hardship, you'll see that there is a trend, and some of these families have been experiencing hardship from childhood. So there's an intergenerational component to food insecurity that we have a tendency not to think about. So it's important to think about food insecurity from childhood and how it's cumulative over time and can be leading to our current rates of food insecurity. Secondly, if we look at the results if we take the next step and look at food insecurity as a predictor of health disparities, especially in the area of obesity and diabetes, we see a strong correlation, strong positive correlation between food insecurity and obesity among women. Less is known about men, partly because they're not included in samples. But if we look at the results, they're a little bit all over the place. We see positive findings, we see negative findings, we also see non-significant findings. And again, the results vary as a result of the samples varying, but also because I think of the perceptions of how men and women think about food and how they answer the food insecurity questionnaire. So if we look at the food insecurity questionnaire, it's an 18-item questionnaire developed by the USDA. And individuals that responded affirmatively to 3 to 7 of the items are categorized as low food secure. And they are more likely to respond positively to items that suggest they're worried about food running out, food did not last, and they were not able to afford a balanced meal. In other words, they're more likely to have a reduced quality of their diet. These are individuals that if you walk into their household, you're like, they're not food insecure, there's food here. But if you look closely at the type of food, the quality is not optimal. Very low food secure is the most severe type of food insecurity, and these are individuals that responded affirmatively to 8 or more of the items. They have a tendency to answer that they cut the size of their meal or skip their meal, they ate less than they should, and they're hungry, but they did not eat because they didn't have the means to. So in other words, these individuals reduce the quality and quantity of their diet. These are the individuals that you walk into their house and there's little to nothing in their fridge or in their pantry. So based on those items, I think men and women may be answering or conceptualizing food in different ways. And partly this is related to the division of labor. So while men may acknowledge that there's low access to food, they may not know the level of severity. There is research indicating that women go to all sorts of strategies to get food on the table and to reduce food shortages that they hide from their children and from their partner. So while the partner may be aware there's food shortages, the actual anxiety and stress of how to get that food on the table may be stronger with women. As a result, men may have less anxiety about this one particular topic, and it can result perhaps in less physiological changes to stress in their body. So while I believe that it is important to, while I like to conceptualize food insecurity as a women's health issue, I think it's important to continue including men and encouraging men to participate in our studies, because otherwise we're not going to improve women's lives if we don't know how food insecurity is influencing their health differently from men. I think we need to focus on behavioral mechanisms and physiological mechanisms that could be happening in the interplay between the two in order to better understand how food insecurity influences health and health disparities. And last, I would like to end with the importance of community-engaged research. As I stated earlier, I was trained as a population health scientist, big, large public health data sets, behind a computer, not really engaging with the community. When I moved to Houston, I had the opportunity to really engage in the community. As a Latina, my second language is Spanish, so I immediately was able to make a connection with the community and start conversing with them. And when I started to do this, I realized the difference that it made in my research, and I began to understand the topic so much more. Plus, I felt like I started to have an impact. I had an impact on the community. So community-engaged research is a way to educate the community and to transform our knowledge into tangible products. The way to do this is to inform yourself. It's really important. Many researchers have a tendency of just wanting to go into the community and change the world without being informed. Many of these communities and community organizations don't want us there, and don't want us there because they've been burned. So it's really important to know the political climate of the organization and what they think about university professors stepping in. Second, it's important to listen, and it's important to listen from everyone, from the clients, the staff, the volunteers, all the way to CEO, and understanding their perspective. I volunteered for 9 to 10 months before I ever did my first project at one of the community organizations. One of the things I did was I helped with a food distribution. Every single week I was in charge of the carrots and handing out the carrots as part of the food distribution. And there was an older adult man who would come, and he would always refuse my carrots. And I was upset. Why do you keep refusing my carrots? And he finally told me, he's like, I don't have teeth. I need things that are soft and that are soft. So anybody that took last night's cooking class, that's why we pureed the chicken. But you know, it started to make me think about people's food choices and why individuals may not select healthy foods when they are given the access to healthy foods, right? So they may not be selecting it because of other health issues. So I have many stories like that that I just learned a lot and made me think about it. So besides my self-volunteering and preparing my students, I decided, what's the next best thing? And the next best thing is to have yourself and your students live a day or a week in their shoes. So my students and I did the food stamp challenge for a week. We received funding from the university to do so, and I have a video that shows this.
The way the class usually works is I give them an assignment and I tell them you have to budget food for 1 week on top of rent and electricity and transportation. I wanted to take it a step further this time and have the individuals experience it themselves. So the assignment was, you will be given a $25 grocery card. You need to budget and figure out how you're going to make meals from $25 and try to make healthy choices.
I just, because it just gives me a little bit of appreciation for what I have as opposed to what people that are less fortunate than me have.
My mom was on, I tell everybody, my mom was on food stamps, and she told me how hard it was, but now I actually see a lot more. It's sometimes it's overwhelming. I'm just thinking, I can't have lunch anymore, I can't have my tea, I don't want to buy tea, I don't have money for that, I have to ration everything, I have to start penny pinching.
Just focusing on the financial assistance, it's not that much. It's just a couple dollars per meal.
The first day when we went grocery shopping, everybody had to put something back. And it was embarrassing. It was a sacrifice. You had to hold up the line.
I was really nervous that I was going to exceed the $25 limit. I had to put a can of black beans back. For people who live this, I'm sure it's very nerve-wracking and almost embarrassing if they have to put items back because they can't afford it.
The big question about food stamps for me is it sustainable? Like, I won't have health complications in the future, and it's not looking pretty right now.
I was there for 2 hours, and I was really trying hard to get things that were healthy. Most people don't have that kind of time. People really don't have time to make the healthy decisions for food.
It's impossible to get all your nutrients, at least as far as what we've seen with the class. Like, you want to choose foods that make you feel full, and those foods aren't always healthy for you. So I mean, staying full is also another challenge.
I had a decent amount of produce because I was vegetarian. I don't know how I'm gonna get my protein, my calcium, my iron. Eggs is the closest thing to meat I got, and beans. But the only way I would be able to meet my iron needs is if I got iron supplement, but that's not covered by food stamps, so I couldn't get it.
My strategy was to kind of buy items that could be used to make multiple meals. I bought squash, like green squash, and 2 cans of tomato sauce, as well as some pasta and some ground beef. I bought some things that I could make like tomato-based meals with, so that I didn't have to buy more ingredients.
No, I didn't think I'd be this hungry. Breakfast has been just a Tangelo every morning. Maybe one day this week I'll have my 1 Greek yogurt that I have. Eating whenever I want is something that I definitely had to give up, and it's very difficult to do that. It's to plan out your meals and make things stretch, and knowing to put it away whenever you maybe want a little bit more, but you know you can't because you have to make it last.
I'm craving a lot more. Studying is becoming a little difficult. Everything I picture as food.
I'm really hungry, like all the time. You don't realize how little food it is until you actually try and cook it all together and make good meals out of it.
The Department of Health and Human Performance and the Honors College, we're training the next set of health professionals. They'll be better able to understand the food choices that their low-income clients and patients are making because they themselves have gone through a week in their shoes, basically.
Something that's actually interested me a little bit, that people are living like this, and to do a little bit more research into it and kind of look and see maybe there may be a future in some kind of nutritional research.
Because I want to go into community nutrition, I think it will be a good experience to be able to relate with some people, know what they need, know what they're going through, know what they're missing.
Not everybody on food stamps is abusing the system.
I don't think the average person understands that it is a problem. Like, I was talking to some friends and they're like, oh, people on food stamps, they spend their money in other places and they can get good food, and I'm like, well, actually, no. Like, I'm only spending my money on the food for the week, and I'm having a difficult time.
I definitely think about my mom and what she actually went through. It's not a walk in the park. It's not fun.
Many of these students are now community health workers in the area. After this, we basically then started to do our research, and then we disseminated our findings. I just encourage all of you guys that if you're going to do community work, disseminate your findings, even if it's not related to that project. Disseminate something. It's important to get our knowledge out there in tangible products. Thank you.